key tips to conquer the NCLEX. And then we're going to be practicing questions as well. NCLEX is not memorization. So NCLEX, the NCLEX exam is not a memorization exam. Instead, you have to develop the ability to apply nursing knowledge. And in order to do that, you need to have a structured study plan. So I want to help you create a structured study calendar. So how do you create a structured study calendar? Basically, you have to divide it in two sections. One, content, but the other one, critical thinking and prioritization. I have said this many times. You can be an expert in nursing content, go to the NCLEX, and still fail. And you may ask, why? Why do I go to the NCLEX and fail if I am so good at content, at nursing content? Because you're lacking the other ability, which is the critical thinking. So I want you to include in your study plan an opportunity to learn not only content, nursing content, but also prioritization and critical thinking strategy. Now, let's go to the content side. What do you need to study for content? Okay, you need to focus on the most important category first. Which are the most important categories? All of them are important, but you need to start with the most important, which is number one, management of care. More than 20% of your exam is going to be about management of care, which of course includes delegation questions and prioritization questions. This is why I say without prioritization, without critical thinking, there's no passing the NCLEX. Now, on top of management of care, safety and infection control. You need to focus, dedicate some time to study safety and infection control. And of course, pharmacology, maternity, and pediatrics. So this is the core, the most important. How do I know this? Well, I have been preparing students for over 8 years on passing the NCLEX. And I talk to them all the time, every week. We have 3-4 students taking the NCLEX, passing the NCLEX. And I talk to them. Come on, tell me what happened. What did you see on the NCLEX? And these categories that I am mentioning to you are on all of the exams. So I repeat it again. Safety and infection control, management of care, pharmacology, maternity, and pediatrics. That does not mean that the other categories are not important. Now, you need to divide your study time into effective study blocks. Well, what do you mean by that, Professor? What do you mean an effective study block? Yeah, you need to create a study block between 90 and 120 minute sessions, no more. And you need to take at least a 5-minute break in between sessions. It depends if you're studying full-time or if you're part-time, how many of these effective blocks you're going to have in a day. That's up to you. It depends on how much time you have to study. Now, this is key. This next step is key. You need to create a checklist. You need to create a daily checklist and prioritize NCLEX preparation during your day. And this is kind of a, let's say, an auto-evaluation technique. Because what do you think is going to happen if you go throughout the day and when you go to your daily checklist, you don't check anything for NCLEX preparation? And 1 day passes, 2 days passes, A week passes, you have done nothing for NCLEX preparation. Do you think you should be taking the NCLEX anytime soon? Probably not. So this is this is important. Having a checklist is going to keep you organized, and it's going to give you a like a track record of how much you're studying and if you're studying effectively or not. So this is key. If you really want to have a good opportunity to pass the NCLEX, you have to do this. Okay? Now, what else? What else do you need to do? And why do you need to do this? A structured plan will give you clarity, will reduce stress, and will increase your chances of passing the NCLEX successfully. Now, that is not it. That is not all. That is tip number 1. Tip number 2 is the most important. Who's ready for tip number 2? This one, what I'm going to be sharing with you today, will change your ability to answer NCLEX question drastically today. Who's ready for tip 2? Let me see. Let me see who's ready. I don't see any likes. I don't see any comments. What is going on? Are you guys sleeping or are you guys awake here? What's going on? Tell me. Are you ready for this? All right. Why don't we do something? Because I see we have about 61 students in this live. And I know there's more than 61 nurses around the world preparing for the NCLEX. Why don't you help me do something? Share this live right now. Copy the link on YouTube and share it somewhere on a Facebook group, on your Facebook page, on a WhatsApp group. Share it somewhere. That way people know that I'm doing this live and they can come to receive this tip number 2. Help me with that. It would not only help me grow our channel, this is, of course, it's going to help me a lot, but more than helping me, help me help other students. So why don't you do that? Copy this link and share it somewhere where you know that there are nursing students preparing for the NCLEX. They're struggling, they're lost, they don't know what to do, because this next tip is going to change their ability to pass the NCLEX. I know this for a fact. Over the past 2-3 years, this YouTube channel has been a blessing to many nurses around the world. And if you can put aside my funny accent and forget about that and understand what I'm saying, it's not about accent. It's about knowledge. You see, just because I speak with a little accent does not mean I think with an accent. Okay? So that's important. So put all that away. All that judgment. I don't like this bald guy with a funny English accent. Forget about that. And listen to the information I am sharing, because I know that if you learn it, you will pass. You will pass the NCLEX on your next attempt. All right? So let's do this. Tip number 2. Let's go for tip number 2. Tip number 2 is very important. Use a strategy map to answer NCLEX priority question. What do you mean by that? What do you mean by a strategy map, Professor? I'm going to show you. I'm going to show you what a strategy map is. I have one on my own, and I'm going to be sharing it with you today. And although this strategy map that I'm going to be teaching you tonight is not going to be for all priority questions, it's going to be for about 20% of the priority questions you're going to see in your exam. So I ask you a question. Do you ever feel lost when it comes to answering priority questions? Do you often narrow the answers in between 2 possible answers, but always or almost always end up selecting the wrong answer? Does that sound like you? Do you make that mistake? You eliminate you eliminate two answers and you are left with two possible answers, and always you pick the wrong one. I'm going to help you today fix that problem. How are we going to do it? We're going to follow, or you're going to follow, this strategy map that I am going to be teaching it to you today. This strategy map is going to make a big difference. It is how to use a strategy map, okay? You can create your own map, that's okay. You can think of putting things together, but if I am sharing this one with you, just use it. All you have to do, take a photo or write it down in your notes, and you're going to be using this strategy anytime you see a prioritization question where there is a mixture of answers that are assessment and implementation, okay? So using a strategy map is going to give you a step-by-step process to analyze each answer and, and select the correct answer. So for example, let's say you're analyzing a priority question and you see that some answers are assessment and some answers are implementation. For example, take the blood pressure, monitor oxygen saturation, or giving a medication, teaching the patient or the family. That's the difference between an assessment and an implementation. How do you use this strategy map? Right here. So basically, you're going to see that in a prioritization question where you have assessment answers and implementation answers, you can ask this question. The scenario that I am facing, has the nurse conducted an assessment in that scenario? If the answer is yes, on the map, you put yes. Let me get the little pen here and put some notes here. So you ask the question, has an assessment been conducted? Has it been completed? Yes or no? Go to the map and put assessment, yes, or assessment, no. The next question is this an emergency? Is this scenario that you're facing an emergency? If the answer is yes, put yes on the map. If the answer is no, put no on the map. Now, you're going to have different scenarios. One scenario could be no assessment completed, no emergency. What's the answer? Assessment. That's going to be your answer. If you're facing a scenario where no assessment has been completed and it's not an emergency, your answer is assessment. You could have another scenario. Maybe there is some of an assessment, maybe a very subjective assessment, but no emergency either. Your answer is going to be another assessment. But in those scenarios where you're dealing with an emergency, as you can see in the map, if you're dealing with an emergency and you're clicking under the emergency column, yes, this is an emergency, most of the time, your answer is going to be an implementation. You go through the process of elimination and select the correct answer. It's that simple. Now, let's practice it, because I know when you see it just on the map, it's difficult to understand. Let's actually see it on a practice question. Okay? So I'm going to show you the practice question. So let's use it here on this question here. It says, I'm going to put it a little bit bigger so you can see the question. I'm going to put myself smaller. There you go. So you can see the question bigger. Let me know if you can see it.
Correct. That's the proper way.
You can see it bigger, right?
Yes.
Okay, perfect. So, which nursing intervention is priority for the client who reports experiencing acute pain? Let's stop right there. Don't do anything else. I want to ask you a question. Let's follow the strategy map. Number one, when you read the question, which nursing intervention is priority for the client who reports experiencing acute pain? I ask you a question. Has the nurse conducted an assessment? Yes or no? Just tell me. Do you see any information on the stem of the question that indicates the nurse did an assessment? No. So what do you do on the map? You put no on the first column, on the first row. Okay? Let's ask the second question. Just with this information, experiencing acute pain, does that indicate an emergency? So no assessment has been done. The patient is reporting experiencing acute pain, but that's it. It doesn't say where. It doesn't say the level of pain. It doesn't say the severity of the pain. It's just acute pain, sufficient information to determine that this is an emergency. No. So look at the map. If you're dealing with a scenario where no assessment has been done and it is not an emergency, what's my answer? According to the map, my answer is going to be an assessment. That's my answer. Now, let's see what answers are assessment. And we can eliminate the answers that are not assessment. So number one is very easy. It says, assess the client's verbal and nonverbal behavior. That's an assessment. So we keep it. Number two, wait for the client to request pain medication. That's an implementation. Gone, eliminated. Because I'm looking for an assessment answer. Number three, administer the pain medication on a scheduled basis. That is an implementation. I'm looking for an assessment answer. Gone. Number four, teach the client to use only imagery every hour for the pain. That's an implementation answer. Gone. Through the process of elimination, the correct answer is one. Assess the client's verbal and nonverbal behavior. Now, does it make sense? Of course, yes. Because assessing the client's verbal behavior includes asking questions. Where is the pain? What is the level of pain? 1 to 10. Assessing nonverbal behavior describes also levels of pain. So this assessment is key to determine what's going to be my next action. So the correct answer is number one, because it's the only assessment answer that validates what the patient is reporting. 2, 3, 4, eliminated. Now, I see some of you commenting professor, but it says on the question, which nursing intervention is priority? Shouldn't I be looking for an implementation answer? No. This is a big, big mistake. Because in this scenario, the word intervention means an action. The action can be assessment or it can be implementation. So it's very important to understand this. When you use a strategy map, if you follow the process step by step, you will get to the correct answer. Most of the time, you will not get distracted and confused. It takes time, it takes practice, but you can do it. We can do it together. That's why I've created this YouTube channel, to help you. I will tell you this, guys, ladies and gentlemen. There's no other YouTube channel that does this. All the YouTube channels that are there for NCLEX Prep is full of content. Nobody's teaching critical thinking. I don't know why. Because without critical thinking, there's no passing the NCLEX. And I need this stop. I want to make a difference. And I could say, you know what? Come to my course, and that's the only way I'm going to teach you strategies. No, I do it here, openly. And yes, I do have live courses. They're great. As a matter of fact, Saturday, I'm giving my second class of the fast track course. And we have a bunch of students signed up for that class. And it's great. Anybody that wants to come to our live courses, we're here. But I want to give you quality stuff here for free on the YouTube channel as well. That's why I'm doing this live. No, I'm not hiding anything. This is me. This is who I am. I want to help you. I want to help the community. I know there's thousands of you around the world that cannot simply pay a $300, $400 course. I know that. I'm from Cuba. See, I'm not from the US. I'm from Cuba. I know what it is to be in a country where there's issues, there's no money, and you cannot afford it. I understand that. That's why I created NCLEX Crusade International. And I'm very happy. I actually want to show you this. I forgot to show you last time. I want to thank you guys for this. I got my 100,000 subscriber plaque. Very, very happy for that. Very humbled for what God has done with me and this channel. And I know it's going to grow more. I know one day it's going to be 1 million subscribers, and I'm going to get the next plaque. I believe that. Not because of my abilities, because God is with me. I know he's going to help me do that. Because I want to help many of you. So help me. I'm trying to help you. Help me. Help me grow. Help this channel grow. Help other nurses around the world that are lost. They don't know what to do. We're going to do it together. So thank you. Thank you very much for that. So we're going to continue sharing good quality stuff. I'm going to try to be this year very active with this YouTube channel. We've been so busy with our Latino side of the NCLEX preparation. We have a Dominate course with like 260 students enrolled. So we're very busy. But I'm going to try to continue doing stuff here in this YouTube channel. Hopefully I can stay motivated. Ask God to give me motivation to continue doing things, because it's hard sometimes. Okay? So, do you want to practice one more question? And then I give you the surprise. I give you the good news that I have for you tonight. You won't believe what we are creating for you. I know that it's going to help a lot of people. All right, let's do one more question. It says, a 35-year-old woman with type 2 diabetes comes to the emergency room with complaints of nausea, excessive thirst, frequent urination, over the past 2 days. Her current medication includes metformin, a diet plan, which she admits to not following closely during the past week due to family stress. Her blood glucose level on arrival is recorded at 350 milligrams per deciliter. What will be the most appropriate nursing action to take immediately? And here's the key word: immediately after stabilizing the client's blood glucose level. If you do not see these keywords, you can easily get distracted. I ask you this question: what is the priority now? Stabilizing the blood glucose or not stabilizing the blood glucose? What's my priority now, according to the stem of the question? Do I need to worry about stabilizing blood glucose level? Tell me in the chat. Tell me in the chat. Tell me in the chat. So if you look at the scenario and you look at the last sentence, it says immediately after stabilizing the blood glucose level. So if you don't look at that detail, you're going to make a big mistake, and you're going to think that the priority answer is to administer insulin, and it is not the correct answer. Why is it not the correct answer? It was already done. It was already done. That's not my priority. So letter A, or answer number 1, I can eliminate. So if you do not know how to find these details, you're going to make big mistakes. So A is not the answer. Discuss the potential complications of diabetes, emphasizing on the risk of diabetes ketoacidosis. Okay. Letter C, is scheduled for a follow-up appointment in 1 week to reassess her medication efficacy and dietary compliance. Or D, instruct the client the importance of adhering to her prescribed medication and dietary regimen. Oh, what an excellent situation. Because there is something known as the umbrella option. There is something called the umbrella strategy, where one answer encompasses other answers. So what is my priority? If you look at answer number 4, or letter D, it talks about several things. One is teaching, adhering to medication plan, that is key for the patient to improve, and also dietary regimen. Well, does it make sense to the condition described on the stem of the question? Yes. The patient has type 2 diabetes. The patient has type 2 diabetes, so type 2 diabetes has to do with nutrition as well. So letter D not only includes medication treatment, but also dietary regimen or nutrition. So letter D is an excellent response. Well, but look at answer B. Answer B, we can eliminate it. Who can tell me why answer B is not the answer. It's a keyword on answer B that tells you that that's not the answer. It cannot be the answer. It's the wrong answer. You have to use the process of elimination. What is it? Why is B not the answer? Tell me. Who can tell me? I'm monitoring the chat here. Potential? No, that's not the answer. Not because of potential. Ketoacidosis. Okay, what about ketoacidosis? What about ketoacidosis? Using some content now. Oh, type 2 diabetes mellitus, the complication is not ketoacidosis. Ketoacidosis, diabetes ketoacidosis, is a complication of type 1 diabetes mellitus. So B does not make sense. 1 was already done. It's telling you on the question that blood glucose stabilized. So all we're left with C and D, or 3 and 4. And what's the priority? To schedule a follow-up appointment or teaching the importance of adhering to prescribed medication and dietary regimen. Thank you, Cici Sanchez, for donating to our channel. I appreciate it. Thank you very much. So when you look at this and you use that process of elimination, you're going to select correctly the answers. But you have to use a step-by-step approach. See, in this question, I didn't even use a map. There is a map for this question as well. A structured step-by-step process. I just gave you a brief overview. But I want you to understand that if you create this and if you follow this step-by-step approach, you're going to answer better and better. Okay? All right. Who's ready for some good news? For quite some time, many of you have been asking about YouTube Premium membership. I have to be honest with you, I didn't even know what this was until I started studying the other day. And I got some information of how to start my YouTube Premium membership. So I've created basically 3 available membership, very inexpensive. So if you're interested in something a little bit more in detail, here's what I've come up to create something in my channel that can support most of the community that cannot afford a live course. Okay, this one I'm pretty much forced by YouTube to create it, which is a very basic membership. I put some special membership badges there, priority message reply, and many of our students are using it to kind of support the channel. So if you want to support the channel, get the special members badge and priority replies, that's an opportunity for you. But when it gets very in detail, is the silver membership. Okay, the silver membership basically includes everything the bronze membership includes, but there's gonna be member-only videos. Okay, that I'm gonna create separately. Of course, I'm gonna continue doing this live. I'm not gonna leave everybody behind. Okay, I'm gonna continue doing the weekly lives. Okay, but this is something extra for those who want it. Okay, special membership premium, the silver membership, is going to include strategies, practice questions on video format, very inexpensive, $9.99 per month. You can cancel at any time. Okay, but the silver membership is excellent, but the platinum membership, what I'm doing here is amazing, guys. I'm going to be uploading videos every week, little bit by little bit, and I'm going to provide my Next Generation NCLEX course. For those of you who have been following me for a while, that course was $597. We had many students that paid that for that course. And I'm going to upload those videos from those live classes every week. So far, I think we have about 12 videos. We're going to be uploading probably 10 more videos next week on the platinum membership. That is $24.99 per month. You can cancel at any time. So you have the three options for those of you who want to enjoy and join our premium membership. Okay? The bronze, the silver, and platinum. And remember that the silver and platinum is the one that includes videos. So I saw many of you enrolling into the bronze, hoping for videos. Is the silver and platinum, the one that has videos. So I want to congratulate Lara Brito for becoming a premium membership member. So welcome, Lara. Pina, also welcome. You joined, I think it was today or yesterday, you joined the premium membership. Drew also joined our YouTube premium membership. So welcome to our YouTube premium. So this is what I had for you guys today. I hope that many of you can use this opportunity to join the YouTube premium. I want to thank YouTube for allowing this to happen. They are amazing. I really love YouTube and how they help the community grow. So basically, we're going to be here again next week. Providing more content, providing more information, continue practicing questions together. I'll be doing a lot of tips over the next few weeks. But if you're wanting to join our YouTube premium channel, just log in. Let me share the link to join. Give me 1 second. For those who want to join, so you can have it available. All right, here's the link. I'm going to put it here on the comment section. Okay, so but basically you just go to the main channel and you put join instead of subscribe, and it will take you straight to the premium option. Okay. So far we have 12 videos on the platinum membership option, and we have, I believe, it's about 4 videos on the silver membership. So we're going to continue uploading more every week. Okay. So thank you for joining, guys. Thank you for coming by. I'll see you again next week. I'm debating of maybe joining here on YouTube maybe twice a week to support the community. Let me know if you want that. If you want me to come live in the general YouTube twice a week, and what days work the best for you guys. If you can comment that on the comment section so I can see it. Friday is definitely a good day for me, so I'll definitely continue doing Friday. But any other day that works the best for you guys in the afternoon, let me know. And also, please write on the videos questions that you could have about anything, about NCLEX preparation, so I can see it and I can discuss them during the lives. I don't know why you guys are not using that. Use that opportunity. Comment. What are your questions? What are your doubts when it comes to NCLEX preparation? And I'll come here and I'll discuss it with you live during our live training. Okay? All right. Sounds good. Well, for those who are enrolled in the fast track course, see you Saturday at 9 a.m. 9 to 4 is our next class, and we're going to be discussing case studies and NCLEX style questions. All right. You can call our advisor. If Cici, if you can put your number there on the chat, so they can contact you. Thank you, Ms. Cici Sanchez. Thank you very much. How many hours should I study daily? Well, that's gonna depend on how much time you have. But if you're a full-time student, any between 6 and 8 hours is good. Full-time student. Part-time student, try to do 2 to 4 hours, per day if you can.